Have you ever thought about how diabetes and heart problems might be connected? Let's explore this link together. By understanding how they relate, we can keep our hearts and bodies healthier. Let's dive into the connection between diabetes and heart health and see how it affects us. Hello everyone. Welcome to today's video, where we embark on an enlightening exploration of the relationship between diabetes and heart health. In a world where chronic diseases often intersect, understanding how diabetes and heart health are connected becomes paramount for our overall well-being. So, grab a seat as we unravel the layers of this complex web and uncover the secrets that link these two critical aspects of our health. Let's think about how your heart and your blood sugar levels work together like partners in a dance. If one isn't doing well, it can affect the other. Understanding how diabetes and heart health are connected is like solving a puzzle. By learning about this link, we can find ways to stay healthier and happier. So let's explore this connection together and see how it can help us live better lives. 1. Revealing the complexities of diabetes. Understanding how diabetes affects heart health requires delving into what we call the diabetes dilemma. Diabetes isn't just about sugar, it's a condition that affects how our bodies manage blood sugar levels. But it's more than that. It's like being part of a complex orchestra where every instrument plays a role. When diabetes isn't managed well, it can lead to a series of problems, especially for the heart. High blood sugar levels over time can harm blood vessels, causing a condition called atherosclerosis. Atherosclerosis makes arteries narrow and stiff, but that's not all. Diabetes also increases the risk of having other issues like high blood pressure and abnormal cholesterol levels. How does all this affect the heart, and what can we do to stop it? Diabetes, a multifaceted metabolic disorder, unveils a myriad of complexities that significantly impact an individual's health and well-being. At its core, diabetes disrupts the body's ability to effectively regulate blood sugar levels, leading to a range of physiological imbalances. Beyond its primary hallmark of hyperglycemia, diabetes influences various organ systems, including the cardiovascular, nervous, and renal systems, creating a ripple effect of complications throughout the body. One of the key challenges in understanding diabetes lies in its heterogeneity, with different subtypes and etiological factors contributing to its pathogenesis. Type 1. Diabetes, characterized by autoimmune destruction of insulin-producing beta cells, contrasts with type 2 diabetes, which typically arises from insulin resistance and impaired insulin secretion. Additionally, gestational diabetes and other less common forms further underscore the diverse nature of this metabolic disorder. 2. The mystery of cardiovascular well-being. Let's talk about the heart, the engine that keeps our bodies going. When diabetes enters the scene, it complicates matters for the heart. Atherosclerosis, fueled by high blood sugar, can cause plaques to form in arteries, which can lead to heart attacks and strokes. But wait, there's more. Diabetes can also cause inflammation, which silently harms the heart. On top of that, conditions like high blood pressure make the heart work harder. Exploring the mystery of cardiovascular well-being involves investigating these factors and understanding how they contribute to heart health or increase the risk of cardiovascular diseases like heart attacks, strokes, and heart failure. It underscores the importance of ongoing research, education, and preventive measures to unravel these mysteries and promote better heart health for individuals and communities. 3. Bridging health with lifestyle choices. In the dance between diabetes and heart health, our lifestyle choices take center stage. What we eat and how much we move can either help or harm our hearts and our diabetes. Eating a diet full of fruits, veggies, whole grains, and lean proteins is good for both diabetes and heart health. Exercise is also crucial for managing diabetes and keeping our hearts strong. By making conscious and positive lifestyle choices, we can bridge the gap between our current state of health and our desired state of well-being. For instance, adopting a balanced and nutritious diet can help prevent chronic diseases like diabetes and heart disease. Regular physical activity can improve cardiovascular health, boost mood, and increase energy levels. Managing stress through techniques like mindfulness or relaxation exercises can reduce the risk of stress-related ailments such as anxiety and depression. 4. Managing medications. Let's talk about medications and how they fit into managing diabetes and heart health. Some medicines that control blood sugar levels can also lower the risk of heart problems. Similarly, medications for heart health might also affect diabetes. The tricky part is finding the right balance between medications for diabetes and those for the heart. We want to make sure that one doesn't make the other worse. It involves several key aspects: prescription and selection. Healthcare professionals prescribe medications based on the patient's diagnosis, medical history, and specific needs. The selection of the right medication involves considering factors such as efficacy, safety, potential side effects, and drug interactions. Dosage and administration. Patients need to take medications in the correct dosage and according to the prescribed schedule. This often requires careful attention to instructions provided by healthcare providers or written on the medication labels. Some medications may need to be taken with food or at specific times of the day to optimize their effectiveness and minimize adverse effects. Monitoring and adherence. Regular monitoring of medication use is essential to ensure that the treatment is working as intended and to identify any potential issues or side effects. Adherence to medication regimens, which involves consistently taking medications as prescribed, is critical for achieving positive health outcomes. Healthcare providers may use various strategies to support medication adherence, such as providing education, simplifying medication regimens, and addressing barriers to adherence. Adjustments and modifications. Medication management also involves making adjustments or modifications to the treatment plan as needed. This may include changing the dosage, switching to a different medication, or discontinuing medications that are no longer necessary or effective. Healthcare providers carefully evaluate the patient's response to treatment and may recommend changes based on their clinical judgment and the latest evidence-based guidelines. Communication and collaboration. Effective communication and collaboration between patients, healthcare providers, and other members of the healthcare team are essential for successful medication management. Patients should feel comfortable discussing their medications, concerns, and any challenges they may encounter with their healthcare providers. Healthcare providers, in turn, should actively engage patients in shared decision-making and provide clear explanations about their medications and treatment plans. 5. Adopting proactive measures. In our journey to understand diabetes and heart health, prevention emerges as a key theme. While managing these conditions is crucial, preventing diabetes and its impact on the heart is even better. Getting regular checkups to see if you're at risk for diabetes, maintaining a healthy weight, and adopting heart-healthy habits early on are important parts of prevention. Understanding the link, exploring the connection between diabetes and heart health. Diabetes and heart health are intimately connected. When someone has diabetes, their body struggles to regulate blood sugar levels. But the impact of diabetes goes beyond just sugar. It affects the entire cardiovascular system, including the heart. In this exploration, we'll uncover the complexities of this relationship and discover how lifestyle choices, medications, and prevention strategies can help manage and mitigate the risks associated with diabetes and heart disease. The Diabetes Dilemma: Unraveling the Complexity. To grasp the connection between diabetes and heart health, it's essential to understand the diabetes dilemma. Diabetes isn't a simple condition, it's a multifaceted challenge that affects various aspects of health. At its core, diabetes disrupts the body's ability to regulate blood sugar levels effectively. However, its repercussions extend far beyond glucose management. Diabetes intertwines with the cardiovascular system, presenting a complex interplay that significantly impacts heart health. When diabetes remains uncontrolled, it sets the stage for a cascade of complications, many of which take a toll on the heart. One such complication is atherosclerosis, a condition characterized by the narrowing and hardening of arteries due to the buildup of plaque. This process is fueled by prolonged exposure to high blood sugar levels, which can damage blood vessels throughout the body, including those supplying the heart. Moreover, diabetes elevates the risk of developing additional cardiovascular risk factors such as hypertension, high blood pressure, and dyslipidemia, abnormal cholesterol levels. These comorbidities further exacerbate the strain on the heart and contribute to the overall burden of cardiovascular disease in individuals with diabetes. Thus, understanding the intricate dynamics of the diabetes dilemma is essential for devising effective strategies to safeguard heart health. Exploring the complexity of cardiovascular challenges. As we delve deeper into the relationship between diabetes and heart health, we encounter the cardiovascular conundrum, a complex interplay of physiological processes that underscores the challenges faced by individuals with diabetes. At the heart of this conundrum lies the cardiovascular system, a network of blood vessels and organs responsible for circulating oxygen and nutrients throughout the body. In the presence of diabetes, this intricate web of cardiovascular function is disrupted, placing considerable strain on the heart. Atherosclerosis, a hallmark of diabetic vascular complications, results from the chronic exposure of blood vessels to high levels of glucose. The formation of arterial plaques restricts blood flow, increasing the susceptibility to life-threatening events such as heart attacks and strokes. Furthermore, diabetes fuels inflammation, a silent yet potent contributor to cardiovascular damage. The inflammatory response triggered by diabetes exacerbates endothelial dysfunction and accelerates the progression of atherosclerosis, further compromising heart health. Additionally, conditions like hypertension impose additional hemodynamic stress on the heart, amplifying the risk of adverse cardiovascular outcomes. Bridging the gap with lifestyle choices. Amidst the complexities of diabetes and heart health, lifestyle choices emerge as fundamental pillars of prevention and management. The adoption of heart-healthy behaviors, encompassing dietary modifications, regular physical activity, and stress management, represents a proactive approach to mitigating the impact of diabetes on cardiovascular health. A diet rich in fruits, vegetables, whole grains, and lean proteins serves as a cornerstone of diabetes and heart disease management, promoting optimal blood sugar control and lipid profiles. Similarly, regular exercise not only improves insulin sensitivity and glucose utilization, but also enhances cardiovascular function, reducing the risk of cardiovascular events in individuals with diabetes. By embracing lifestyle interventions, individuals can cultivate a symbiotic relationship between diabetes management and heart health promotion, empowering individuals to make informed choices regarding their diet, physical activity, and stress management. Empowers them to take control of their health and reduce the burden of diabetes-related cardiovascular complications. Exploring medications and management approaches. guiding through the pharmacological terrain. In the realm of diabetes and heart health management, medications play a pivotal role in attenuating cardiovascular risk and optimizing metabolic control. Pharmacotherapy, targeting blood sugar levels, such as insulin and oral anti-diabetic agents, not only improves glycemic control, but also exerts favorable effects on cardiovascular outcomes. Certain classes of anti-diabetic medications, including sodium glucose cotransporter 2, SGLT2, inhibitors, and glucagon-like peptide-1 receptor agonists, GLP-1 RAs, have demonstrated cardiovascular benefits beyond glucose lowering, reducing the incidence of major adverse cardiovascular events and heart failure hospitalizations in high-risk individuals with diabetes. Conversely, medications aimed at cardiovascular risk reduction, such as statins and angiotensin-converting enzyme AC inhibitors, confer ancillary benefits for individuals with diabetes by attenuating the progression of atherosclerosis and preserving cardiac function. However, the concomitant use of multiple medications necessitates a nuanced approach to therapy selection and dose titration to mitigate the risk of drug interactions and adverse effects. Promoting wellness, embracing a comprehensive strategy for health and prevention. In the pursuit of optimal health outcomes, prevention emerges as a cornerstone of diabetes and heart disease management. By proactively addressing modifiable risk factors and implementing evidence-based interventions, individuals can mitigate the onset and progression of diabetes-related cardiovascular complications. Regular health screenings, encompassing assessments of blood glucose levels, blood pressure, and lipid profiles, facilitate the early detection of diabetes and cardiovascular risk factors, enabling timely intervention and risk stratification. Furthermore, adopting a comprehensive approach to preventive care, which integrates lifestyle modifications, pharmacotherapy, and patient education, empowers individuals to optimize their cardiovascular health and mitigate the burden of chronic disease. As we conclude our exploration into the intricate connection between diabetes and heart health, one thing becomes clear. These two aspects of our well-being are bound by more than mere coincidence. The dance between diabetes and the heart is a complex symphony, and understanding this connection is the key to orchestrating a healthier future. Thank you for joining us on this enlightening journey through the intricate web that links diabetes and heart health. If you found this information valuable, don't forget to like, share, and subscribe. If you have any questions or topics you'd like us to explore in future videos, leave a comment below. Until next time, stay curious and take care of your heart.